Hello everybody and welcome to Focus on Fitness. Our focus today is the increasing number of our youth who are participating in sports, and as a result a greater number of youth injuries. And so you'll want to stay with us for the next 20 to 30 minutes because we're going to delve into this subject, which is unfortunately becoming more of a problem in today's youth sports market. And we have two people who I think can address this issue very eloquently. To my right is Dr. Mary Lloyd Ireland, Associate Professor and Orthopedic Surgeon at the University of Kentucky, Orthopedic Surgery and Sports Medicine. And Mary Lloyd, welcome back to Channel 13. It's been a while, but we're glad to have you.
Thank you. Great to be here.
And to her right is Sheri McNew, Director of Athletic Training Services, University of Kentucky, Orthopedics and Sports Medicine. And Sheri, rookie appearance here, and we're glad to have you as well.
Thank you.
I'll start with you first, Dr. Ireland. Kind of give us an overview from your perspective based on the data that you've been able to examine and things that have come across your desk about where we are with youth sports and, as a result, youth sports injuries.
Well, the great thing is we have more youth competing in both organized sports and hopefully being fit forever. So 30 million kids are participating in youth sports. Since I was a athlete and graduated from high school in the 70s, we've had a 10-time greater increase in females participating in girls' sports in the high school level. So there's been a great boom, but along with that, we do see a different pattern of injury, and that's an overuse injury, an injury that occurs with repetitive jumping, running, practicing for so many months out of the year. And there's certain sports that I think we'll talk about that are big problems. So we see a lot more injuries these days because there are a lot more kids participating.
Which, Sheri, like Dr. Ireland said, is a good thing. I mean, it's quite obvious the benefits for you participating in youth sports. Elaborate on some of the others.
You know, definitely it cuts down on obesity, gets kids active, and as Dr. Ireland alluded to, it's a lifelong activity that they can do and get used to. So, you know, the benefits of fitness, definitely cardiovascular, cuts down on disease, diabetes, etc. Everything that our society is now dealing with, physical activity can help with. So we're very happy to see an increase in the physical activity of our youth.
Share with us, and I'll start with you, Sheri. There's a ton of data out there, and I know in preparing for this program you sent me a list of viable stats as it relates to this issue, and certainly, Mary Lloyd, you could jump in, but what are some of the ones that jump out at you that are relevant to our discussion?
As far as the increase, like Dr. Ireland said, there's 30 million plus kids that now participate in sports, recreational and organized. So 3/4 of the households in the U.S. have one child that participates in youth sports. Along with that, we've seen an increase in the number of emergency room visits, increase in the number of visits to orthopedic physicians because of the injuries that these youth are now experiencing because they're a lot more active. So our big push right now, because of all that, is getting education and getting the word out of how to prevent these injuries.
Okay, anything to add to that, Mary Lloyd?
Well, it seems one of the problems with kids is they want to compete, and they're not going to tell you they're hurt, and so they kind of keep it a secret, particularly from their parents and sometimes from their coaches, and sometimes it's their peers that know that they're hurt. So you can't rely on them to tell you that they're hurt. And so, you know, communication and education is what we really try to do to the coaches, and we would like to diagnose problems early and treat them and hopefully prevent other things from happening in the future. So I think the main key is communication with your child about, are they happy doing the sports that they're doing, and you know, are they hurting somewhere? Do they feel good?
What are the major causes of youth injuries, most youth injuries?
The youth injuries that we're talking about a little bit more today are overuse. In other words, it's not free play. It's not climbing up in a tree, falling out and breaking your arm, which is actually a pretty easily treatable thing. We're talking more about practices for 2 hours, oftentimes year-round now. Youth baseball is a very critically injured young boy who has a elbow injury that can change what he does for a career, or certainly get him out off the pitching mound. So there's certain injury patterns that we're seeing, and what we're saying with overuse is it's repetitive micro trauma. In other words, it's not one throw, it's repetitive throwing again and again, and youth baseball is particularly of concern for us to try to prevent things from happening, and it's the growth plates that are still open that are more likely to injure than in adults. Tendons will have problems, but oftentimes it can be the growth plates and the ligaments, particularly in the elbow in youth baseball pitching.
Okay, well let's go into that, the baseball area. There was a recent article in Sports Illustrated that dealt with this very issue and overuse. As a matter of fact, I think the word that was used in that article and the word that was used in the information that you all presented me was that there was an epidemic of injuries. What can be done? What is going on right now specifically to baseball, to these young kids who are participating, and what can be done to correct it?
I think young baseball pitchers, the one that start pitching very early, aren't the ones, and since I am a girl, I guess I can say throw like a girl. So they're the ones that can really throw correctly, and they can throw too hard too early, and those are the ones that we see get hurt. And the prevention aspect is really getting parents involved with pitch counts. The utility baseball player makes a better pitcher in college or in pro sports if they didn't start pitching at age 8. So oftentimes I'll have parents that are the advocate of the youth pitcher. And Nolan Ryan didn't start pitching, I think, till he was a junior in high school. So the kids that start pitching at age 8, we might see at age 12 who can't straighten their elbow out. They have an injury to the ligament, and again, that's a pitching career-ending event that is gradual. And again, the child is not going to say, my elbow hurts. So with some coaching techniques or looking at them of, can they move their elbow totally, having athletic trainers, which in Fayette County we have the luxury of having at the schools, having them be more involved with early diagnosis and seeing early, is there a small problem that hopefully will not become a torn problem and not fixable.
So it sounds like education is the key, because you have two competing forces as it relates to baseball. And we're not picking on baseball, but it has been the subject of several recent national articles. You have the forces from where you're speaking from about preventive injury as opposed to the forces of winning the game. How do you get around that?
It's very difficult. Yeah. It is tough, and the psychology of sports. I mean, it really is tough. But for these youth, they're not going to say they hurt. They're more concerned about making the coach, the parents proud, not letting their peers down, and they're going to throw through pain, and that's something that I don't think youth understand what pain is. I mean, I certainly do. I stop, but they don't get it, and they don't really understand what pain is. And these individuals that are growing so quickly too, a lot of forces go on the elbow because they're just shooting up so quickly. They don't have the agility, the balance, and the real strength to be able to maybe throw the ball correctly and not put so much force at certainly the elbow joint is the one that we're seeing more injuries in, but also the shoulder.
Okay, and you talked about briefly there growth plate. Kind of break that down for our viewers as exactly what the physiology of it as it relates to their participation in sports.
Well, the growth plates basically are where the cells live that make bones longer, and the growth plate injuries that we see most commonly in youth sports can be overuse. People have probably heard of Osgood-Schlatters disease. It really isn't a disease, it's more of an imbalance where the kneecap tendon pulls on a little growth. Basically it's an offshoot, and so kids will have pain in the front part of their knee below the kneecap, and that's worse when they're doing a lot of jumping. So like if we have a basketball player who's growing a lot, they have real tight hamstrings, they have a little weakness in the front of their quadriceps muscles, and then a lot of force goes to that tendon. So if they keep on jumping on this knee, potentially they get it inflamed and then very painful. And